If you've been dealing with joint pain that just won't go away, you know how incredibly frustrating it can be. But what if there was a way to deliver relief directly to the source of the problem with unbelievable precision? Well, that's exactly what we're going to dive into.
And let's be honest, this is a question that hits home for way too many people. Whether it's from arthritis, an old sports injury, or just the wear and tear of life, that constant, nagging ache can really start to limit everything you love to do. So you've probably tried the usual stuff. You've been good about taking your medication, you've put in the work at physiotherapy, but that pain, it just hangs around, doesn't it?
And that feeling, that sense of being stuck is just so disheartening. But here's the thing. Those conservative treatments are not the end of the road. There is another path, a much more direct one.
And that path leads us to orthopedic injections. See, instead of a pill that goes through your whole system, this is all about targeting the problem with laser-like accuracy. Let's break down the main types, shall we?
First up, you've got corticosteroids. Think of this as a super concentrated, powerful anti-inflammatory, like a firefighter sent directly to the source of the fire. It puts out that local inflammation, and when the swelling goes down, so does the pain.
Next, there's hyaluronic acid. This is a real game changer for arthritic joints, especially knees. The easiest way to picture it, it's like giving your joint a top-of-the-line oil change, helping everything glide smoothly again with a lot less friction and pain.
Then we have something called platelet-rich plasma, or PRP for short. Now this is fascinating stuff. It's a regenerative approach that uses the powerful growth factors already inside your own blood. We concentrate them and then re-inject them to basically supercharge your body's natural healing ability. And finally, for that sharp, radiating pain, I'm talking about things like sciatica. There are nerve blocks. This treatment is all about finding the exact nerve pathway that's sending those pain signals and just interrupting the message. It's kind of like temporarily flipping the off switch on the pain. Okay, so these treatments are obviously powerful, but what makes them truly effective? Well, the key, the secret sauce, is seeing exactly where the medicine is going. And that, my friends, is where image guidance comes in.
And this right here is the critical difference. A standard or blind injection relies on the doctor's feel and their knowledge of anatomy. It's an incredibly educated guess, but it's still a guess. With image guidance, using tech like ultrasound, the doctor can literally see the needle and the target area on a screen in real time. It's the difference between navigating with a map and navigating with a live GPS. You know with absolute certainty that the treatment is going to the exact spot it needs to.
So, what does this all look like in practice? It's a very structured, very safe, 5-step approach. It all starts with a deep dive, a thorough evaluation of you. Then, the area is prepped to make sure everything's sterile and you're comfortable. Step 3 is the main event, the real-time guided injection. Afterwards, there's a quick monitoring period just to be safe, and, this is crucial, you don't just walk out the door. You leave with a solid rehabilitation plan to make sure you get the best, most lasting results. It's the whole package.
Okay, this all sounds pretty great, right? But the big question is, who's a good candidate? How do you know if this targeted approach is the right fit for you?
Well, let's see. Do any of these happen to ring a bell?
If you're sitting there nodding along because you've got that chronic joint pain or persistent swelling, or maybe an old injury that just refuses to fully heal, if you're dealing with that sharp, shooting nerve pain, or if, bottom line, pain is just getting in the way of your life, then yeah, image-guided injection therapy is definitely something you should be looking into.
As we've seen again and again, precision is everything. This isn't just about the type of therapy, it's also about the expertise and the technology being used by the team.
And this is exactly why choosing the right provider is so important. You want to look for specialists who are properly licensed, who are using advanced guidance tech. A really good clinic is going to offer you a whole range of options, not just a one-size-fits-all solution. And maybe most importantly, they're going to integrate that injection with a long-term physio plan, and they're going to put you, the patient, right at the center of it all.
And that really just says it all, doesn't it? The whole philosophy is right there. The goal isn't a temporary band-aid. It's about using precision to get relief that actually lasts.
All right, so before we wrap up, let's just quickly answer a couple of the most common questions people have when they're thinking about taking that next step.
This is probably the #1 question on everybody's mind. Okay, great, but how long is this actually going to work for?
And the honest answer is it really varies from person to person. For some people, it might be several weeks of relief. For others, it could be many, many months. It all depends on your specific condition and just how your own body responds.
And the second big question is always about downtime. You know, we're all busy. Nobody has time to be laid up for weeks.
Well, the news here is fantastic. The recovery is incredibly quick. Most people are right back to their normal everyday activities within just a day or two. You just have to hold off on any really strenuous exercise for a little bit.
So, that leaves us with one final question. And this one is really for you. If chronic pain has been calling the shots in your life, maybe it's time to explore a more precise, more effective way forward. Just think about it. What could you do, and how amazing would you feel if you could finally move comfortably again?